I was hoping some of us, if we want to introduce ourselves verbally rather than in the chat, I think that would be great.
So hi everyone, I'm Andrew.
Hi, my name is Mallory. I was diagnosed with partial lipodystrophy when I was 12 and I'm 24. I've worked with Dr. Orel since I was diagnosed, and thanks to her I'm still here and feeling so much better. So thank you.
This is a really exciting session because Dr. Chun and Dr. Orel work with a member of our community in a more personal way through a case study. There was just a great article published about it. Mallory, if you're ready to put your camera on. And so we're going to do a little panel to have Mallory, Dr. Orel, and Dr. Chun speak about that experience and speak about their work to really show how clinicians and patients can work together. So we're really excited for that.
Mallory, are you coming?
Hello.
Yeah. Hi.
That's a little overview of how you work together.
Sure.
Mallory, take it away.
Dr. Orel and I have worked together since I was 12 years old, so for about 12 years. And we have always been in close communication with each other. She's been talking to my mom too.
Yeah.
And we recently started a new, well, not recent, it's been almost about 7 years, on Regeneron, which there's an actual name for it. I don't know how to pronounce it.
Nipocalimab.
Yep, that one. And first we started, my mom and I went and saw Dr. Rel every Tuesday, and then we go every 3 months now. And we've just had such a great relationship with her. And yeah, she just feels like another mother to me.
So, I recall meeting Mallory when she was 11 to 12, right? And Mallory happens to be very close in age to my kids. So I think meeting her with her mom was, made me feel all those maternal feelings as soon as I met them. They also have a very touching story. Mallory, do you want to sort of describe that part of you, or
like how I was diagnosed,
or just how you were diagnosed, and
I started showing symptoms when I was 11. My mom noticed my legs were super thin and veiny, and she thought I was just deficient in protein, or I was super dehydrated at first. And so we went to my primary care doctor, and then they sent us to a genetics doctor at U of M, and he sent us to Dr. Orel, and we met her, and she knew exactly what was most likely going on, and so we were very fortunate to be diagnosed.
Well, we knew she had a form of partial lipodystrophy, but it did have atypical features, right? There were some features that were different than all the other patients we had followed, or there were some unique aspects in her presentation. So we thought that it might be worthwhile to bring in the newest genetic technology, especially after we've tested for all the known things, right? Mm-hmm. And Mallory and her mom are really close, and they work really well together, and their love just comes to you when you meet them. So I think part of my luck has always been meeting great patients and great stories, partly owing to the experience of having given leptin for the first time and seeing the remarkable improvement that had happened in our very first patient, and in the first 7 or 8 patients that followed, sort of had changed me forever. So that's one of the reasons why when we have a patient who has something different or known therapies don't work, that somehow starts a button in my brain, that we have to do something, and what we have to keep pushing the boundaries. And sometimes we're lucky, we can find the answer. Sometimes we're not. There have been patients who I followed for 18 years, and then we had our aha moment. So this, is a long journey, right? And we've been through a journey like that with Mallory, right? We met her when you were 12, and here we are when you're 24, when we think we have a glimpse of what's going on in you biologically, right? So it was a long road. You stuck with it. You stuck with me. You entrusted in me. And you did have a big unmet medical need. There were times in your life when you were in the hospital the entire school year, right? Almost.
Yeah.
So we felt like we had to do something different for your therapy, and that's why the investigational drug from Regeneron had come to the table. We actually had treated Mallory with Myolept first, and then she developed a neutralizing antibody to Myolept, and that's when her metabolic situation really worsened, and we felt desperate, and that's when we reached out to Regeneron for their drug, and they were excited to share it with us. And Mallory was the first patient that with lipodystrophy that received it, and she's to date the patient who's taken it the longest in the world. And it's a big leap of faith, right? To take a medication that hasn't been given in your disease state, but she's responded really well to it, and that allowed Regeneron to sort of develop its program of mebevidimab. So it was kind of a win-win for both Regeneron and for the lipodystrophy community, and it's all owing to Mallory's acceptance and sort of trust to receive that drug. But we know that that's not the cure.